Thank you so much for joining us today, Dr. Landsberg.
It's my pleasure.
A transplant is a treatment, not a cure, but a transplant is most often the best choice for a dialysis patient. Can you talk about why that is?
So you're right. For the majority of people, a kidney transplant is the best treatment. It's the best from many points of view. From a medical point of view, success rates are good, and actually even things like life expectancy are better with the transplant than they are with dialysis. As well, there's the whole quality of life. And so the freedom, the flexibility, the ability to travel. People usually feel stronger, they feel healthier, they're more able to live a normal life. And many people with a transplant live, a very normal life. You would never know that their neighbors, their friends would say they're just normal people. And so transplant, it gives somebody that, which you don't get from dialysis. However, it's not for everybody. There are some reasons why somebody should not get a transplant, because it would be too dangerous, or there are situations where the outcome won't be good enough for us to recommend that as a therapy.
Now, maybe this is a good time to talk about the two types of donation. There's living kidney donation and there's deceased. Can you briefly describe the differences between the two?
Yes, of course. So living donation is when a friend, a family member, somebody from the community, or even a stranger, while alive with two normal healthy kidneys, otherwise in good health, goes into the hospital, has an operation, their kidney is removed, and the kidney is then transplanted into the person who needs it. Other people are on the waiting list, and this will happen randomly when somebody dies who is an organ donor and who is compatible with the patient on the waiting list, and they're the person to get it, then they'll get a call, come into the hospital, and the transplant will happen at whatever time it needs to happen. So it's done in an emergency situation. Living donation is scheduled. The living donation, the donor leaves the hospital, is healthy. The deceased donation is when somebody dies, and therefore two kidneys are transplanted. So when there's a deceased donor, usually we're able to do two kidney transplants.
As we discussed, living kidney donation is actually the ultimate type of donation. Can you talk about some of the advantages to living kidney donation?
So as you say, the ability to schedule it and then to make sure that everything is good before you go ahead. You can always choose to say, okay, well, maybe we've got to figure this out, or maybe we've got to do this and delay it. With deceased donation, first of all, there's a variation in the quality of the donor kidneys, and we don't have a lot of time to do a lot of testing to decide. I mean, within a few hours, usually it's, are we going to use this organ or are we not? Sometimes they're fantastic organs, but sometimes they're not as strong necessarily as living ones. But in addition to that, there's the whole trauma that's happened to the donor who's deceased, which led up to this. That's hard on the kidneys. Whereas with the living donor, none of that is obviously in play. So from an outcome point of view, in general, living donor transplants last longer on average than deceased donor kidneys, although some deceased donor kidneys will outlast even the best living donor kidney, but those are few and far between. So looking at averages, better to have a living donor than a deceased donor.
And often with a living donor, kidney patients might avoid dialysis.
So that's a key thing. So the best treatment is never to have to go into dialysis. And so if you can get a kidney transplant before you start dialysis, that's ideal. The only way you can get a kidney transplant before you start dialysis is with a living donor. Because of the scarcity of deceased donors, we don't have enough to go around, so we don't even list patients for transplant until they start dialysis, in order to be fair to people, because somebody might be referred 2 years earlier. They would get if we just said, okay, as soon as you need one, we'll list you. They'll get ahead of the queue as somebody who was referred later, and some people don't even know about kidney disease. And So since we don't have enough to go around anyway, the fairest thing to do is to use dialysis start as the start of your waiting time.
Right.
So if you're going to get a kidney before you start dialysis, it's a living donor.
As you can imagine, asking someone to donate a kidney to you could be a rather daunting task. We're going to talk to Dr. Landsberg when we return about some tips and tools for how you might go about doing that. So don't go anywhere.